I'm Glen Metcalf. I have a history of type 2 diabetes and high blood pressure, and I've been on medication for a number of years. I was admitted to the hospital the Friday just before Thanksgiving with unknown issues. Well, I didn't know, and nobody else did either. They had to struggle to keep me alive.
I vividly remember at about 6 a.m., I was working a shift at Vancouver General Hospital when I received an incredibly sick patient from the ambulance. He was sitting bolt upright on the stretcher. He was writhing in pain.
I really don't remember much of anything at that particular time. I don't remember arriving at the hospital.
I'd never experienced anything like that before. The way things went so fast and the way the hospital staff didn't know what was happening. Somebody thought he was having a heart attack, somebody thought something else.
As we were preparing him to go to radiology, he actually stopped breathing. And fortunately, we were able to resuscitate him.
I think that's when it really hit that he might not make it. We basically started to pray.
His pH was 6.67. That's the lowest pH I've ever seen in a patient who's alive. And at that moment, it was very clear to me that this was likely related to one of the medications he is on. He was on one of the most commonly prescribed medications for diabetes called metformin, but in him, it was causing a very significant adverse event.
They had to start from scratch, go through all my records, find anything that may have been related to this.
What took a lot more time was to figure out that this was not the first time this patient had had such a terrible adverse event to a medication. In fact, he had already been admitted twice before to one of our hospitals with the exact same diagnosis. So this was his third adverse drug event, and he almost died from it.
I didn't know that Glen had gone to a different hospital at another time, so why wasn't there any information on that? Like, why didn't somebody know? How do those types of things happen?
You know, the third time, much more serious. I can't even speak to how serious it was because I was almost dead. Over the years trying to keep my diabetes and blood pressure under control, I've seen some specialists and some brilliant doctors. I'm just not sure if there was kind of ongoing communication between everyone. So it's a collaboration between all of the levels of health, from your pharmacist to your family doctor to your specialist.
Patients who have adverse drug events, they frequently, unfortunately, get re-exposed to the same drug. We often have to adjust the dose. A lot of times we stop the drug and replace it with something that they have not had an adverse event to. But in order to be able to do that, everybody within that patient circle of care needs to know about that adverse drug event. For me as a care provider, it feels like we're not connecting the dots correctly.
When you go to a doctor, they can generally look up all your medications. What they don't know necessarily is that you've had problems with certain drugs. And that's where a program like ActionADE could really step in to make sure that the specialists and your regular general practitioner have the information, or forbid, the hospital staff have that information so they can act quickly on your past history.
This is a problem that can be solved with health information technology developments. It's not a simple problem to be solved, but it can be solved. And we've shown with ActionADE that we can solve it. This type of solution would make our health system so much safer, and I absolutely believe we can get there.